This presentation will focus specifically on breast cancer. Please be sure to have your syllabus out with you so that you can make notes next to the relevant points. Breast cancer is the most common cancer affecting women in Australia. It is the second most common cancer to cause death in women after lung cancer. Breast cancer can occur in males, however, it is uncommon. The breasts are made up of lobules and ducts surrounded by fatty and connective tissue. The lobules produce breast milk and the ducts carry the milk. How does breast cancer develop? Breast cancer can start in the ducts or the lobules of the breast. Initially, it may be a non-invasive breast cancer, where the cancer cells stay in the ducts and lobules of the breast and may present as a small lump. An invasive breast cancer, on the other hand, are cancer cells that spread into the surrounding tissue, and the site where the cancer started is known as the primary cancer. A metastatic breast cancer is where the cancer cells travel into the bloodstream or lymphatic system to other parts of the body. The risk factors for breast cancer can be broken up into non-modifiable and modifiable risk factors. The non-modifiable risk factors are those that cannot be changed, and they include gender. Predominantly females are affected by breast cancer. So being a female is a risk factor. Family history is also a risk factor. Increasing age, early onset of menstruation, and late menopause are also risk factors for breast cancer. The modifiable risk factors for breast cancer include obesity, poor diet, inadequate exercise, excess alcohol consumption, and late maternal age at first full-term pregnancy or childlessness. These are all risk factors that can be changed or altered. Skin cancer protective factors include breast self-examination. Breast cancer will often present as a lump, and if that lump is detected early, the likelihood of survival is very high. Breast screening or mammograms for those over 50 years is also a protective factor because, again, if the breast cancer is detected early, there's a high likelihood of survival. Becoming familiar with family history is also a protective factor. If someone in the family has had breast cancer previously, that knowledge can stimulate protective behaviours such as breast self-examination and seeking mammograms more regularly. A healthy diet high in vegetables, fruit and low in fat is also considered a protective factor from breast cancer. Reduced alcohol consumption is also a protective factor, as alcohol does increase the risk of breast cancer. Sociocultural determinants of breast cancer can include a family history of breast cancer, but also health-promoting behaviours within the family, such as encouraging self-examination. Promotion or awareness of screening in society has increased over the past decades, or perhaps a lack of promotion in some parts of the country. This is all linked back to the society and the culture that people are immersed in. Other sociocultural determinants include an acceptance of risky alcohol consumption, a Western influenced diet which is high in saturated fat, which may contain fast or processed foods, and a sedentary lifestyle. Some cultures tend to promote these sorts of risky behaviours. Some socioeconomic determinants of breast cancer can include the increased incidence that's linked to changes in family structure. So women that are having children a little bit later in their lives, such as approaching the age of 40, can be a risk factor for breast cancer. And this is linked to a number of things, such as females entering the workforce, families needing a dual income. This has led to families putting off their first child. And so women are marrying later, and therefore the first pregnancy is later. And this delay is a response to the greater financial demands and the desire for women to focus on careers. So this is a socioeconomic determinant and is thought to increase the risk of breast cancer. Environmental determinants of breast cancer can include lack of access to screening facilities, particularly those in rural and remote areas, and those that are overseas born that may not have the language skills to be able to understand or seek assistance in this area. But living in major cities may also be a risk factor due to the risk of sedentary behaviour and access to fast foods and processed foods. The groups at risk for breast cancer include women who have a family history, women who consume alcohol at risky levels, women who are approximately 50 years and over, women who are obese, live in rural areas, women who started menstruating at a very young age, women who have never given birth or give birth later in life, women who have experienced late menopause, and also women who are born overseas. Those from North America and Northern Europe appear to have higher rates of breast cancer. Thank you very much for listening.